Hi, this is Team 6 and we're doing 3D printing on medical devices. So there are three main sectors of 3D printing in medicine: medical devices, biologics or bioprinting, and drugs and pharmaceuticals. These are separated by their purpose and use.
Our team will focus on the medical devices. And here's the breakdown of our presentation.
First, we'll start with key stakeholders. So within key stakeholders, the ones with the highest amount of power and possibly the lowest interest are FDA regulators, followed by payer and insurance companies with high amount of power and possibly low interest, then government policymakers with good amount of power and a lower interest. Physicians and providers have more interest since this is more applicable to their business and have a significant amount of power as well. Then patients might have a high interest as to how this might affect their healthcare, but they have a low amount of power, followed by scientists and researchers who have a high interest because this might be work that they work on, but they have a low amount of power. And lastly, manufacturers who might have low interest and low power as well. Then we move on to market segmentation and analysis of market size by segment.
So the market size total for around the world for 3D printed medical devices was estimated to be 1,480 million US dollars, and for North America alone, it was estimated to be approximately $621 million in 2019.
And 3D printing medical device market has been segmented into the following categories, which are medical implant, prosthetics, tissue engineering, surgical instruments, surgical guide, and hearing and audibility aid.
We break this down by the product type and use, and just to note, surgical guides our focus is on how they're used in the oral and dental sphere.
3D printed medical implants are used in orthopedic, dental, and craniofacial fields. There were over 350,000 3D printed medical implants for the orthopedic uses in 2017. These orthopedic implants could be created for less than $100 each, which estimates a market size of over $35 million for implants in the orthopedic field. For the market size analysis of prosthetics, it's important to note that 1.6 million people in the US have a limb difference. Out of these individuals, 541,000 have an upper arm difference requiring a prosthetic. A myoelectric arm using 3D printed materials costs about $1,000, creating a market size for such prosthetics to be approximately $541 million. If we move on to the next slide, this shows that for tissue engineering market size analysis, it's necessary to understand that 3D printed scaffolds are what create templates for cell interaction, providing support for developing tissue, which makes the creation of biomaterials possible. In the US, there were 120,000 patients who required organ transplants in 2018, and there are 8,000 liver transplants in the US every year. Bioprinted livers can cost $10,000 each, which shows that the US market for bioprinted livers created with 3D printed scaffolds could be estimated to be $80 million a year.
In terms of surgical instruments, we choose to focus on the retractor surgical instrument, and the cost per unit that's 3D printed, the 3D printed version of this is about 1/10 of the real cost of a stainless steel one. So that would be about $1.35. And we multiply that by the number of surgeons within the US to get an estimate of about 74,000 for the market size. In terms of surgical guides for oral and maxillofacial, there are about 2,419 dentists in the US, and the surgical guides cost an average of $625. When we multiply those numbers together, we get a market size of about 125 million. And in terms of hearing and audibility aids, most hearing aids are already 3D printed or have 3D printed parts. And there are about 3 million hearing aids sold in the US in 2018, and the average cost of one is about $2,500. Multiplying that average cost by the number of hearing aids sold, we get a market size of about 9 billion, close to 10 billion.
Moving on to non-market forces. We first analyzed the current non-market forces that impact the 3D printed medical device market using the PEST framework. There is a strong public demand for cheaper and more accessible medical devices in the market from all stakeholders. There is a lack of 3D printing specific policies, which offers a low entry barrier. Investments in 3D printing and 3D printed medical devices are both increasing, and the low marginal cost of productions of these devices facilitates the market growth. In general, people are becoming more familiar with 3D printing, and with the guidance of FDA, this leads to unhindered market traction. Lastly, accuracy and complexity of 3D printing in general is assisted by the growth of computing power.
And there are three non-market forces we learned in this course. And first one we are going to introduce is intellectual property. One of the main concerns about 3D printing is that its use makes it technically possible to copy almost any object without the authorization of those who hold rights in that object. So the current intellectual property law addresses this issue as protecting an object from being printed in 3D without authorization does not raise any specific intellectual property issues as such. So for example, copyright will protect the originality of the product and the creator's right to reproduce it. And this means that if copy of the original objects are 3D printed without authorization, the creator can obtain any support or aid under copyright law. And similarly, industrial design rights protect an object's aesthetic appearance, like its shape and form, and while a patent protects its technical function. And the three-dimensional trademark allow creators to distinguish their product from other competitors' product.
Great. And the second force is regulation. The currently FDA regulation on 3D printed medical devices is not significantly different from the regulation of conventional medical devices, and it follows the same pathways through FDA's Center for Devices and Radiological Health, CDRH. Pre- and post-market requirements apply to these devices in the same manner. In 2016, FDA issued a draft guidance, but it's not effective at this time. Third force is reimbursement. 3D printed medical devices are mostly reimbursed via diagnosis-related group. Majority of payers have not dealt with these devices yet, and they wouldn't know if they're dealing with these devices versus conventional ones because of the DRG method of payment. 3D printed medical devices with a higher price premium will face a higher degree of scrutiny through rigorous health technology assessment by payers. Next slide.
Next slide. Next, we will talk about notable trends. Over the past several years, 3D printing industry has undergone dramatic transformation. Recent research has shown that while printer manufacturers' earnings were hit hard back in 2015, the companies have begun restructuring and shifting priorities to industrial applications. It has become highly competitive due to increasing and better technology. Orthopedic devices in 2019 showed that metal and alloys accounted for 65% of the market share. Personalization has become a huge focus in 3D printing medical devices. Next slide. As you can see here, 3D printing medical devices, the compound annual growth rate has showed an increase in estimated of 14.4% from 2017 to 22. And a new report by FactMR showed that about $1,700 million of revenue by the end of 2022. North America is expected to dominate this market, and Asia Pacific, excluding Japan, will have the highest compound annual growth rate through 2022. And the bottom right-hand side of the chart shows anticipated revenue by application by the end of 2022. And you can see here, implants would take up largest market shares, and the little smallest of the market share will be electron beam melting technology. Next slide. And thank you for our presentation, and here are our citations.